This is the next video in my video series of HRT, hormone replacement therapy. And this one is on estradiol injections. And I'm going to be using the information sheet that came with it, plus my experiences taking it since the summer of 2019. I've been on it. So it's the estradiol injection. Pronunciation is estradiol. The brand name in the US is Depo Estradiol, and the product that's dispensed is estradiol valerate intramuscular oil, 20 mg/ml, and it usually comes in a box like this. Covering up that information, but a box like this, and it's usually in a vial like this, small vial with a little cap on it that you just break off. So yeah, and if it's a synthesized version from a pharmacy that synthesizes it, it usually comes in one like this, and it looks kind of like this, the synthesized version when they synthesize it themselves. And you usually get like a syringe, something like in a container like this, and a drawing needles like this. So yeah, there's that part of the information. So here's the rest of the information. It says, do not use this drug to prevent heart disease or dementia. A study of women taking an estrogen with progestin showed a raised chance of heart attack, stroke, blood clot, breast cancer, and dementia. The chance of a stroke, blood clot, and dementia was also raised when the estrogen was taken alone. It is not known if the same effects may happen with this drug. The chance of endometrial cancer may be raised with the use of estrogen alone in patients with uterus. Use of progestin along with estrogen may lower the risk. Use this drug for the shortest time needed at the lowest useful dose. Your doctor will talk with you on a regular basis to see if you need to keep taking this drug. Well, from my experience, if you're transgender, when you start HRT, you usually start on the estradiol pills first, then get switched to the injections, because doing it that way triggers the body to go through the puberty changes. That's the exact same as cisgender women. So yeah, so then you get switched to the injections later. Just wanted to clarify that from my experience. Okay, what is this drug used for? It is used to prevent or lower the signs of changes of life, menopause. It is used to add estrogen to the body when the ovaries have been taken out or do not work the right way. Rarely it is used to treat breast or prostate cancer. It may be given to you for other reasons. Talk with your doctor. Okay, what do I need to tell my doctor before taking this drug? Okay, if you are allergic to this drug, any part of this drug, or any other drugs, food, or substances, tell your doctor about the allergy and what signs you had. If you have ever had a very bad or life-threatening reaction called angioedema, signs may be swelling of the hands, feet, face, lips, eyes, tongue, or throat. Trouble breathing, trouble swallowing, unusual hoarseness. If you have had any of these health problems, bleeding disorder, blood clot, a high risk of having a blood clot, breast cancer, liver problems, or liver tumor, heart attack, stroke, or a tumor where estrogen makes it grow. If you have eyesight problems like loss of eyesight from blood vessel problems in the eye, if you have thickening of the endometrium lining of the uterus, if you have unexplained vaginal bleeding, if you are pregnant or may be pregnant, do not take this drug if you are pregnant. Whew. This is not a list of all drugs or health problems that interact with this drug. Okay. Tell your doctor and pharmacist about all of your drugs, prescription, over-the-counter, natural products, vitamins, and health problems. You must check to make sure that it is safe for you to take this drug with all of your drugs and health problems. Do not stop, or change the dose of any drug without checking with your doctor. And going on that, changing the doses and everything, because of my experience with it, I originally was taking 0.4 ml for a long time, but due to prescription changes with like the micronized progesterone added and being switched off of spironolactone and put on bicalutamide, the estrogen and the progesterone together, progesterone being taken in the suppository route, it lowered my estrogen. No, it lowered the estrogen, and the progesterone lowered my testosterone combined with the bicalutamide to about 3 below 0, like it zeroed it out. So I had to stop taking a testosterone blocker at that time. Then slowly my estrogen, the dose was up higher in my system, so I had to have it lowered down to 0.3, but then it went up again higher than what it was before, so it was lowered again to where it's at now. So depending on what's going on with your body and your doses, it might have to be changed. And the higher the dose doesn't mean you're going to get more benefit from it. Where my dose is now, I'm getting more benefit. So yeah, so that's my experience with having the dosage changed. Okay, what are some things I need to know or do while taking this drug? Tell all of your healthcare providers that you're taking this drug. This includes your doctor, nurse, pharmacist, and dentist, because that can actually affect your teeth. Like hormones can actually do that. So from when I told the dentist a long time ago, they were glad I let them know because that can actually affect your dental health. Okay. This drug may raise the chance of blood clots, a stroke, or heart attack. Talk with your doctor. Talk with your doctor if you will need to be still for long periods of time, like long trips, bed rest after surgery or illness. Not moving or long periods may raise the chance of blood clots. Call your doctor right away if you have the signs of blood clot, like chest pain or pressure, coughing up blood, shortness of breath, swelling, warmth, numbness, changes of color, or pain in leg or arm, or trouble speaking or swallowing. If you have high blood sugar, diabetes, you will need to watch your blood sugar closely. High blood pressure has happened with drugs like this one. Have your blood pressure checked as you have been told by your doctor. So it's pretty much every time you get your blood work done, they should check your blood pressure and everything then. So, yeah, from my experience. Have your blood work and bone density checked as you have been told by your doctor. Be sure to have regular breast exams and gynecological checkups. You will also need to do breast self-exams as you have been told, which that should be done every month, self-breast exams. From my experience, it's better to do it than not. And when your doctor needs to do it and whatnot. So, yeah. Okay. Ovarian cancer has rarely happened in some people taking certain estrogen with a progestin, which a progestin is progesterone. It's a type of progesterone. If you have questions, talk with your doctor. High calcium levels have happened with drugs like this one in some people with cancer. Call your doctor right away if you have signs of high calcium levels like weakness, confusion, feeling tired, headache, upset stomach or throwing up, constipation, or bone pain. High triglyceride levels have happened with this drug. Tell your doctor if you have ever had high triglyceride levels. This drug may cause dark patch of skin on your face. Avoid sun lamps, and tanning beds, which sun lamps and tanning beds aren't really good for you. Use sunscreen and wear clothes and eyewear to protect you from the skin. Well, with my experience, with being on it, my thighs, I noticed if they're exposed to the sun too long, they get burned much more easily than the rest of my body, so you still have to be careful. Okay, this drug may affect certain lab tests. Tell all of your healthcare providers and lab workers that you have this drug. Do not smoke. Smoke raises the chance of heart disease. Talk with your doctor, which if you're on hormone replacement therapy, smoking and other similar recreational drugs can actually affect your overall results. Everyone's different and some can be worse, some can be better. I can't say for sure, but it's just best not to while on it. Limit your drinking of alcohol. That's a good point because with my experience, since having my gender confirming surgery and where my hormones are at, before surgery, where everything was at, I was able to drink a little bit more. compared to now, I'm not able to because it affects my body a lot quicker than what it used to. So that can happen. Your tolerance level can change like mine has. So be cautious if you are going to drink while on hormone replacement therapy. If you drink grapefruit juice or eat grapefruit often, talk with your doctor. This drug may affect growth in children and teens. In some cases, they may need regular growth checks. Talk with your doctor. If you are 65 or older, use this drug with care. You could have more side effects. Tell your doctor if you are breastfeeding. You will need to talk about any risks to your baby. Okay, next section. What are some of the side effects that I need to call my doctor right away? Warning and caution, even though it may be rare, some people may have very bad and sometimes deadly side effects when taking a drug. Tell your doctor or get medical help right away if you have any of the following signs or symptoms that may be related to a very bad side effect. Okay, signs of an allergic reaction like rash, hives, itching, red, swollen, blistered, or peeling skin with or without fever, wheezing, tightness in the chest or throat, trouble breathing, swallowing, or talking, unusual hoarseness or swelling of the mouth, face, lips, tongue, or throat. Signs of liver problems like dark urine. So just make sure when you drink water, you drink adequate enough water. And if you are, and you get dark urine, even though you're getting enough water, is what it pretty much means. Tenderness, decreased appetite, upset stomach or stomach pain, light colored stool, throwing up or yellow skin or eyes. Signs of gallbladder problems like pain in the upper right belly area, right shoulder area, or between the shoulder blades, yellow skin or eyes, fever with chills, bloating or very upset stomach or throwing up. Signs of a pancreas problem, pancreatitis, like very bad stomach pain, very bad back pain, or very bad upset stomach or throwing up. Signs of high blood pressure like very bad headache or dizziness, passing out or change in eyesight, weakness on one side of the body, trouble speaking or thinking, change in balance, drooping on one side or the other side of the face, or blurred eyesight. Eyesight changes or loss, bulging eyes, or change in how contact lenses feel. Well, with my experience with glasses, it was back in 2012, they said my eyesight had gotten worse. But then a couple of years ago when I had it was the beginning of last year when I had my eyes checked, nothing's changed. So yeah, it can affect that. So just be cautious. A lump in the breast pain or soreness, or nipple discharge. Vaginal itching or discharge, vaginal bleeding that is not normal, depression or other mood changes, which hormone fluctuation can cause mood changes. So if it's not the normal hormone fluctuation that happens throughout the month. Depression or mood changes. Okay, memory problems or loss. Fever. Not able to pass urine or change in how much urine is passed. Pain when passing urine. Swelling. Okay. What are some other side effects of this drug? All drugs may cause side effects. However, many people have no side effects or only have minor side effects. Call your doctor or get medical help if any of these side effects or any other side effects bother you or do not go away. Dizziness or headache, hair loss, upset stomach or throwing up, constipation, stomach pain or cramps, bloating. Well, the hormones, how it triggers that hormonal time of the month can cause those. So that's basically saying if it's not the normal, like bloating and cramps from hormone cycle. Then it says enlarged breasts, yes, and tender breasts. Like if your breasts are growing from the hormones, that's what they do. But if it's like the abnormal, because with my experience with it, yes, before surgery, my breasts grew to a certain point, but then after surgery, they have gained a whole cup size and fullness after surgery. So yes, that can happen. So just be cautious on that, because my experience, it does cause all that. So it's pretty much the non-normal of that you need to look out for. Okay, vaginal bleeding or spotting, painful periods, signs of a common clot, nose or throat irritation, weight gain or weight loss. Okay, this is a thing that's happened with me. And yes, be open and stay in contact with your doctors when this happens, because last year when my dose was changed, I lost weight, went from 122 down to 116. It's causing dysphoria, so they had me continue taking the same dose to prevent the dysphoria for a little bit longer before switching the dose. But then when my dose was permanently changed, my weight went back up to 122. But then after surgery, because I was having a hard time gaining weight, because my goal was 130 pounds from where I was. So after surgery, I started actually, when my hormones normalized, I started gaining weight. I went from 122. Then when I had COVID, I lost some weight. But then when I got over that, I started gaining weight again. So I went from that 122 to 130 to 133. And last week, I weigh 139 pounds now. So yes, after surgery, you can end up gaining a lot of weight if you do have the gender confirming surgery. So while taking this, you can gain weight. That's just my experience with the weight gaining, weight loss with it. Okay, joint pain, leg cramps, change in sex interests. Well, for me, I can't say it's really affected that sexual, like the sex interest, because I identify as a lesbian with, like a trans woman. I'm a lesbian with a fluid sexuality, and my fluid sexuality just changes interests and whatnot. And just during the hormone cycle where it's at, if I'm wanting it more or not. But basically, if it's the non-normal changes. So that's just a little bit of my experience with it. Okay, severe irritation where this drug was used. That means when it's injected into the body. For me, my experience with doing the injections, it's intermuscular into the leg. Then once a week, then each week switch legs, which one it's done. I've experienced pain, itching, and some burning. And yes, I've talked with the doctor about this. Because sometimes if you inject it into the fat, which is much easier if you do, it can be a little bit more painful. But if you get into the muscle, it can be even more painful. But it's pretty much the severeness of it if it gets really bad. And sometimes when you take it, you can get a lump under the skin for a while, or bruising, or sometimes it can bleed afterwards, or a little bit of the estrogen can leak out. But as long as your levels are normal, that's fine. That's what my doctor told me. So that's just a little bit of my experience with it. So just be mindful when taking it, and how far up the skin's lifted when you lift up the skin to inject it. Put the needle in, because that can also vary on how that happens with like the irritation or just the pain levels, from my experience. So it's better to inject it into the fat. From my experience, it's less painful. So, and also the direction of the needle, because when you look at the needle, it goes like straight. Then there's a part that's kind of looks like it's cut on an angle. When you have that flat part facing upward, because if you have it facing downward, it's like trying to put a blunt object into your skin, and it doesn't really go through. So if you have that flatter part where it's on that angle facing up, so the point is pointing down, it goes in much easier from my experience. And that can also help prevent some of those issues. And from my experience, I usually try to line up that point where it's flat with the numbers on the syringe. So the numbers would be like here, but then the point on the would be that angle that goes here. So you can actually see when you're pressing the plunger in on the syringe. Makes it a lot easier to see where everything's at, from my experience. Okay. How is this drug? Let's see. No, let's do this. These are not all of the side effects that may occur. If you have any questions about side effects, call your doctor. Call your doctor for medical advice about side effects. You may report side effects to the FDA at 1-800-332-1088. You may also report side effects at, and here's the website and phone number. It's right. You can see that information. It's right there. Get it better. It's like right there. So yeah. Okay, how is this drug best taken? Use this drug as ordered by your doctor. Read all information given to you. Follow all instructions closely. It is given as a shot into a muscle, which my experience, it's painful if you actually go into the muscle. I say rather just go into the fat, like most of the doctors say. That's out there. It's less painful. From my experience, it is. So, yeah, just trust a lot of trans individuals who's taken it into the fat. It's less painful. If you will be giving yourself a shot, your doctor or nurse will teach you how to give a shot. Also, the thing is, when you have the estrogen, what you will also need is this. A lot of these, because what you're going to do is the area you're taking the shot, you want to use the pad to wipe it down. Then the top of the vial where the rubber piece is, you want to wipe that down to keep things clean. Just to keep things clean so you don't get infections or any other weird things that could happen by not being clean. So just keep that in mind when doing it. And when you do, from my experience, whatever your dose is, you draw air into the syringe to that dose. Put the needle into the vial, push the air in so it has that pressure difference. So when you do change out the needle and everything for the drawing and all that, you can get it into the syringe easier. And the bigger syringe is much easier to get it. No, it's like the bigger needle on the syringe makes it easier to get it into the syringe compared to the smaller needle, because the needle used for injecting is like 25 is the best one to use for injecting into your body because it's less painful and it's smaller. But it's usually 18 gauge for drawing into the syringe, so just keep that in mind. And it helps to prevent bubbles the bigger the syringe, like the needle on the syringe is. So from my experience, the smaller needle tends to create more bubbles trying to get it in, and it's a lot harder and slower because the estrogen's more of a gel. So keep that in mind. Do not use if the solution is cloudy, leaking, or has particles. With my experience, it's never been cloudy or leaking, but the particles that end up in the estrogen for me is the rubber part on the top of the vial that the syringe goes into. Some of it has broken off and gotten to the estrogen, so be mindful of that to stay more consistent in the same hole, in the same spot, so that doesn't break off any pieces from my experience. So yeah, which sucks because then it can end up not being able to use the whole entire vial of estrogen, and you don't want to get that injected inside of you, that rubber piece. So it kind of sucks, but if it happens, it happens. From my experience, it's happened more than once. So yeah. Okay, this drug is colorless to faint yellow. Do not use if solution changes color. Throw away needles in a needle sharp disposal box. It's like a sharps container, or a really thicker container or jug you can put it in also. So just be mindful on that. Do not reuse needles or other items when the box is full. Follow all local rules for getting rid of it. Talk with your doctor or pharmacist if you have any questions. Okay, What do I do if I miss a dose? Call your doctor to find out what to do. Well, my experience is I have missed a dose before. What happened was I got up, did my morning routine, forgot my dose, went to my therapy appointment, and that's when I was coming home I remembered, so I just took it. As long as it's not more than like 24 hours before, or like, it's like, be mindful about how long it's been if you missed a dose, because usually if you take it right away, you shouldn't have any problems from my experience. So just be mindful not to miss a dose. How do I store and or throw out this drug? If you need to store this drug at home, talk with your doctor, nurse, or pharmacist about how to store it. So I just store it out of the sunlight, either like in a nightstand. Don't put it in the bathroom to store it, because usually when you do that with prescriptions, the moisture or that heat can affect it. So don't store medications in the bathroom, just store it somewhere or it's out of reach of children. Preferably out of the sun, because the sunlight can actually affect it. So be mindful on that. Okay, general drug facts. If your symptoms or health problems do not get better, or if they become worse, call your doctor. Do not share your drugs with others, and do not take anyone else's drugs. Keep all drugs in a safe place. Keep all drugs out of reach of children and pets, because pets can be curious and will try to eat it, and it's not safe for kids that aren't prescribed it. So just be mindful on that. Throw away any unused or expired drugs. Do not flush down a toilet or pour down a drain unless you are told to do so. Check with your pharmacist if you have any questions about the best way to throw out drugs. There may be drug take-back programs in your area. Last I contacted the pharmacist, they said pretty much call your local fire department or police station. Contacted them on it. That's what I've been told several times in the past. What's been recommended. So yeah. Then if there is a drug take back program type thing where they dispose of it for you, that's even better. So be mindful on that. Some drugs may have another patient information leaflet. Check with your pharmacist if you have any questions about this drug. Please talk with your doctor, nurse, pharmacist, or other care providers. It's like this does come with an extra leaflet. It is folded up like this huge big old thing. So it's worth reading it once, but after you read it once, then you won't have to read it again. So yeah, unless you want to refresh everything. And because that specific leaflet once, like when the thing's unfolded, it's like huge. So yeah, just be mindful on that. Okay, consumer information, use, and disclaimer. This generalized information is a limited summary of diagnosis, treatment, and or medication information. It is not meant to be comprehensive and should be used as a tool to help the user understand and or assess potential diagnostic and treatment options. It does not include all information about conditions, treatment, medications, side effects, or risks that may apply to a specific patient. It is not intended to be medical advice or a substitute for medical advice, diagnosis, or treatment of a healthcare provider based on the healthcare provider's examination and assessment of a patient's specific and unique circumstances. Patients must speak with a healthcare provider for complete information about their health, medical questions, and treatment options, including any risks or benefits regarding use of medications. This information does not endorse any treatment or medications as safe, effective, or approved for treating a specific patient. Up to date, including and its affiliates, disclaim any warranty or liability relating to this information or the use thereof. The use of this information is governed by the terms and use available at this website. So, yeah. So, that's the information on that. And from my experience as a trans woman taking it, from all the physical changes I've got, from pretty much breast growth and just everything that the estrogen combined with progesterone can do with the physical changes I've experienced as a trans woman. It has helped tremendously from my experience, and especially with my mental health, because getting the right hormonal balance in my system. This is coming from my experience. I can't say anything about anyone else, because the brain sending signals to the body and the body sending signals back to the brain saying it's getting the wrong hormones and causing that dysphoria. Getting the hormones recorrected resends the signals to the brain, and the brain says it's getting the correct hormones, and it sends the signal back to the body saying it's getting the correct hormones, so the dysphoria goes away. So that's coming from my experience of taking it, and just not having that signal of wrong hormones in the form of dysphoria is so much better and so much like happier being on the correct hormones from over the years being on it for so long. Because I first started hormones November 20th, 2010, even though there was a couple years, like a few years from 2014 to about 2016, I was on and off, being consistently back on it since October 11th, 2016. I'm doing better hormone-wise. Everything's normal, especially since having gender confirming surgery. What the estrogen's actually doing is helping my body get to where it needs to and not fighting that testosterone anymore. So the estrogen's actually, from my experience, it's more beneficial now without that testosterone than it was before. Because before, with that higher testosterone, it was preventing the estrogen and progesterone from getting my physical changes where they're at now. So after lowering, getting that testosterone like out of my system completely, and being on the estrogen combined with the progesterone, gaining to where my body needs to be. It's helped with all that. It's helped with my mental health, my physical health and appearance, especially with my weight and my breast growth. And it can also help with, if you have gender confirming surgery, it can help with the changes down there, to be healthy and normal throughout the month. So yeah, even with the healing and the appearance of it, this is just coming from my experience being on it for as long as I've been on it. So with combined with the progesterone and gender confirming surgery from before, when I had that high testosterone in my system compared to not having it now, that's a lot more effective. My body stores fat a lot more easier, I can say. This last year, because when you have more estrogen in your system, then it helps to put fat on your body. When you have more fat on your body, it produces more estrogen. So yeah, from my experience, it's a blessing. And if you truly need to be on it for any reason, being on the correct dose is vitally necessary compared to being on the pill. Because having to start on the pill first, I can say from my experience with the estrogen injections, being on the pill first, what happened, being on 6 milligrams a day, split evenly throughout the day, morning, afternoon, evening, taken under the tongue. At night, wasn't getting enough estrogen, and I wasn't getting the changes. But once I got switched to the injections, because it's in your system, could be in your system for 1 to 2 weeks, and that actually helped to be more balanced and stable in my system throughout all day and all night, and not having that drop affecting my dysphoria and my hormonal changes throughout the month, and the physical changes of my body, like the puberty changes that was necessary to get, that was struggling to get. So being on the actual injections has helped in that sense. So it's more like consistent in my system until it gets closer to where I need to take my next dose, and it's just lower in the system. So it's pretty much high, and it slowly goes like this, instead of going like this, then like that, and drop off. Like the pills, you're here, it starts to drop off, then you take the next one, it's here, and it starts to drop off. Take the next one, then it drops off throughout the night. Instead of going like that with the pills, with the injections, it's more stable, and it slowly drops off, slow, and take the next dose, and it's up where it needs to be again. So you don't have that huge drop off and all the emotional and physical things that can happen with it. So that's just the best way I can explain. So yeah, from my experience as a trans woman, a post-op trans woman, taking estradiol injection combined with micronized progesterone, that's my information and my experience with it. So yeah, so until my next video, this is all I can really put into it for such an in-depth long video on it. So thank you for watching, and until I have a next video, just remember the playlist will be in the description for the rest of the videos for the playlist of the HRT hormone replacement therapy.